Hi, today I'm going to be administrating medication for my 9 o'clock patient, Robert Johnson. First thing I would do is I'd make sure I have all my necessary information, such as a physician order, the MAR, and the nursing cardex. And what I would do is I would go to the physician's order, and I would see that there's no new orders, and I would double check all the standing orders. And this is where I would go if there was any discrepancies between the MAR and the nursing cardex. And if I go over the physician's orders and I see any weird orders that I don't necessarily agree with or understand, I would be responsible for contacting the physician and clarifying it. So the next what I'm going to do is I'm going to take my MAR and my nursing cardex, and I'm going to compare my 9 o'clock medications, and they have to be 100% correct. And if they're not, again, you go back to the physician's orders and see which one is the correct order. This is the first medication check. This is making sure my patients have their 6 rights, which are dose, route, right patient, right time, right documentation, and the right drug. So, yep, they match up perfectly. So I'm going to go to my Pyxis, which can be usually in my med room or in the nurse's station. And this is my hospital Pyxis, and usually it'll be computerized, but there'll be charts on the sides to see which drawer my medication will be on, or will be in. And this is where I'm going to go again, and I'm going to just look over the medication, and I'm going to make sure that I only do one patient at a time, because that would be risk for causing patient error and violating the 6 rights of patient medication. So okay, as I take them out, I would double check 100%, everything matches up. That will be the second medication check. And at this point, once I gather all the medications for my patient, I want to document that I have taken them out and what I have taken out. So either I would do this online or I would sign my shift verification. So I'm going to do that. And if any of my medications had to be split in half, I would do it in here. But I would have to make sure that I knew that some medications can't be split up, such as extended release and coated pills. I would also do any sort of my calculations that I had to do in here for this example. I don't have to do any. I look to see that Robert Johnson, the patient that I'm giving my medication to, has 3 PRN medications. I look to see that one of the PRNs has been given too soon, so I can't re-give it. So I see, okay, he has 2 medications, so I'm just going to bring him into his room just in case he wants to take them. And now I would head over to my patient's room, and I would introduce myself. Hi, Robert. I'm Mercedes. I'll be your nurse today. I have a couple medications to give you. Can you please tell me your name and date of birth?
Robert Johnson, April 13th, 1982.
Perfect. How are you feeling today?
I'm feeling all right.
Good, good. Well, I have a couple medications for you, so we're going to go over that. You have enough water. Before I would go in a room, I would make sure that I would get proper report from the oncoming, or from the prior shift. I would make sure that I know all of his lab values. For this example, his labs were taken at 7 o'clock, so 2 hours earlier. All his vitals were good. And anything I would need to know about my patient, such as patient history, allergies, anything like that, why he's here, I have to know that before I go into the patient's room. And that's all on the nursing cardex. I have 5 medications to give you. Would you like them separate or together?
I would like them all separate.
Okay. Sounds good. Well, here we go. And but before I give it out to you, can I please see your wristband? Good. And I would make sure that her ID bracelet had matched what she said. Okay, right now, Robert, this is Synthroid, and this is treating your hypothyroidism. And if she was laying down, I would make sure that her head is elevated because he can do it himself. I'll just make sure that he's sitting up. But if they weren't able to move themselves up, I would just lift the head of the bed up. And I would ensure that it did go down okay.
Yep, we're good.
Perfect. Next one we have is Lasix, and this is a water pill. And I would make sure to open the package and then put it in the little med cup, and that little red cap is my med cup for this example. Oh, and that was my third medication check once I asked her for her name and date of birth, his name and date of birth, and checked the ID bracelet. Okay, and this is now your multivitamin. This is something you've taken at home, and it's just to replace any vitamins that you're not getting through food. And this is your doxycycline, and that is an antibiotic, broad spectrum. Okay. We're almost done, I promise. This is your Tegretol. And I would make sure that if I were to drop any on the floor on the cabinet, it would become contaminated. I would have to make sure that that is documented, that I dropped it and I have to go get a new one. It is not okay to give a patient medication that you had dropped. Okay, Robert, I have 2 PRN medications for you, which means, you can have them every 3 to 4 hours for the Percodan, and that is for pain. You had it about 3.5 hours ago. Would you like to take it?
I would.
Okay. And then on a scale of 1 to 10, how high is your pain?
1 to 6 today.
Okay, and I would make sure to document that for my vital signs and my pain assessment. And then I also have Tylenol for pain, and that was taken about 5 hours ago. I would suggest taking it, but you don't have to. The Percodan will help with your pain. So, do you think you want to take it?
Yeah, I think so.
Okay. And I would have my nursing card X, and if I had any questions about my drugs, I would have this, my pocket guide or my drug guide, so that I would be able to answer any questions that my patient had. And if I didn't have this, I would make sure that before giving it, I would give my patient proper information about it. So I would say, I'm going to go double check for you, and so that you're giving them the right information. So now that Robert here has gotten all the medications down, do you need anything else from me?
No, I think I'm okay.
Okay. And right now I could do any sort of assessments that I need to do. And after all the medications are given, I would just document it right in the room that I gave it to them. And if that is not possible, I would make sure to document that ASAP, because that is one of the patient's 6 rights, and it's very important to make sure for your patient and you that you are documenting everything you do. I'd make sure that he is safe and comfortable, that the call light is within reach and his privacy is intact. I would make sure to gather all of the personal information I brought on him. So my nursing card X, anything that has patient information, because that's a violation of privacy. To just leave it in here, I would grab any garbage I brought in, make sure that they have enough water, bed alarm on if need be, and Thank you. If you need anything else, call us. I will be coming back in about 30 to 60 minutes to do pain reassessment and to make sure that everything's going okay. If you need anything at that time, we can do that. But if you need anything before that hand, just call me.
All right, I'll see you then.
Okay, thank you.